back to my channel. In this video, we'll talk about the various theories of dental plaque. So first one is the non-specific plaque hypothesis, which was given by W.D. Miller. He stated that all the plaque which is present is pathogenic. It has a noxious production which causes pathogenicity in the entire plaque flora. But however, the argument was that there are some individuals who have constant amount of plaque, but still they do not develop the disease, and there are certain sites which are not affected by the disease. Now, what was the clinical implication of this theory? It is that the periodontal disease that may be treated by decreasing the plaque to an acceptable level, maintenance of healthy plaque, total plaque control. Then came the specific plaque hypothesis. This was given by Loesch. He stated that there are specific portions of plaque which are pathogenic, and they have the presence of a specific pathogen like tuberculosis or syphilis bacteria. So, but it was diagnosed that periodontal disease was also present during the absence of certain putative pathogens. Now, the clinical implication of the specific plaque hypothesis was that the therapy, it should be directed towards the elimination of the pathogen through antibiotics. All right. Then coming on to the modern version of the specific hypothesis, it stated that there are only 6 to 12 species which are responsible for the role in the periodontal disease. Then came the ecological plaque hypothesis, which is given by P.D. Marsh and co-workers. He said that the periodontitis is an opportunistic endogenous disease which is caused due to dysbiosis. Now, dysbiosis is basically what we see is a favorable, healthy microbiota changing into an unfavorable, not so healthy microbiota. So the clinical implication was that we need to control the environmental factors. Now, environmental factors such as stress, increase in the amount of sugar, the change in pH. I will talk about it in this video only. Then there was unified theory. It stated that it combined the modern version of the non-specific theory as well as the specific theory. He said that all bacterial plaque may contribute to pathogenic potential of the subgingival flora to a greater or a lesser extent. Then came the keystone pathogen theory. He said that there is low abundance of the microbial pathogens. When they are increased in quantity than the normal pathogens, then there is a change in the composition and it leads to the inflammatory disease. Now, there is synthesis of the IL-8 inhibition and then inhibition of chemotaxis, immune response. Now, coming on to the dysbiosis. Now, dysbiosis is something like this. When there is an excess of sugar, we see acid production. The neutral pH is getting changed into low pH. Then S. sanguis, which is a normal microbiota of the plaque, is converted into a caries microbiota. So, health is converted into caries. So, when we refer to in the terms of plaque, we will draw this one. Suppose there is reduced plaque and then there is increased plaque because of stress. So first there was reduced inflammation, there is the increased inflammation. There was low GCF, now there is increase in GCF leading on probing as well as increase in pH and temperature. First it was gram positive microflora, now it is gram negative. So it is an ecological shift, environmental change leading to an ecological shift, further leading to the conversion or shift from a healthy gingival tissue to gingivitis. So this is what is meant by the ecological plaque hypothesis. So I hope I made it easier for you to understand the theories of plaque. If in case you like the video, do subscribe to my channel, hit subscribe. Thanks for sharing.